For residents of the Northern Beaches, we now know a lot more about the future of the hospital. After Healthscape, the private operator of the Northern Beaches Hospital, went into receivership, the government yesterday announced they'd take over the hospital. It's welcome news for some, while private medical practitioners are still concerned about a loss of services. Dr. Sophie Scomps is the independent member for Mackellar and a former emergency doctor. She joins us now. Morning, Doctor. Morning, Sophie.
Good morning.
So, as somebody who has medical experience, yesterday Ryan Park announced this thing, but he didn't have all the answers. Here was Ryan Park speaking to Hamish McDonald yesterday.
What we haven't agreed to yet is an exact model, so we can't make that announcement today, but we are consulting carefully with clinicians around what that model looks like, and particularly the role of those private services going forward within that hospital footprint.
Are you surprised that the government's taken over the hospital but doesn't actually have a model for how they're going to run it?
Look, I've been talking to a lot of people, and I do think it's a two-step process. So the first step, the thing to say is that Healthscope was delivering both public and private services within the one envelope of the Northern Beaches Hospital. So they're very intermingled, and they did own the services like the pathology, the pharmacy, and the radiology as well. So it is a complex negotiation, and I think that this is the first step, which is fantastic for our community. It provides greater certainty for the nurses, the doctors, everyone who works within the public system of that hospital, and also for our community to know that we've got that continuity of care. As you said, Healthscope was in receivership. We did need to have a solution, and this does provide certainty. But the next step is ensuring that the private services currently delivered at the hospital are maintained.
So you don't want it to go to a full public model. You like the AMA, we spoke to them yesterday, you'd prefer it stayed with private services as well.
Look, I think there's two parts to our health system, and private services play a really important role in our health system. And we know that around 80% of people who reside on the Northern Beaches have private health insurance, so they do use this service. But it also benefits people in the public system to have these highly skilled medical experts, surgeons, specialists who are local, working locally, because they do really drive high-level, world-class services at that hospital. So it is really important that they stay.
Yesterday as well, it not only talks about they don't know the model, there was talk about the fact they don't know what equipment will be left behind by Healthscope. Again, that seems to be something you should probably put in the contract. But if Healthscope takes some of this material, isn't it going to throw the kind of private services into, chaos?
Look, as Healthscope is in receivership, they're trying to sell 37 hospitals around the country. And I think what we need to do is I think it is a really important first step that the New South Wales Health is taking over the entire hospital. And then the next step from there is to see where you land and go from there, and hopefully start those negotiations on keeping those private services. But it is all up in the air, and it is causing some consternation and uncertainty for both the doctors and for our community. And so my role, and I think others in these leadership roles, is really important to keep advocating for the best quality services, both public and private, to continue to be delivered on the Northern Beaches. And if we were to lose those private services here on the Northern Beaches, it would impact the entire health system across the state, because you're increasing pressure on public wait lists and other private hospital wait lists as well. So it doesn't make sense to lose them.
All right, another person joining the Keep the Private Services There side. Thank you for speaking to us this morning.
Thanks so much.
Dr. Sophie Scomps, the independent member for Mackellar and former emergency doctor.
702 ABC Radio.